Yay, the slide's up. That's a good start, isn't it? I'm a little bit nervous about this. I'm going to try and see if I can make it my friend. Thank you very much to the organisers of the conference. It's fantastic to have so many colleagues and other practitioners and academics all together speaking about this really important issue. So what I'm going to do is give you a bit of a perspective about how things are going in Tasmania, already struggling. Am I pushing right or left? Thank you. Okay. So what I want to give you is a bit of it's almost a history lesson about what's happened in Tasmania and how it's allowed us to be in what I consider to be quite a, especially relative to other states that I've worked in, because the policy setting is extremely strong in Tassie. We had David speaking earlier this morning. We want to talk to you a little bit about the past investments and how they've contributed to our current sort of operating environment and made it much stronger. A little around the project that I'm managing, and can I also acknowledge my colleagues here, Sandra Murray from the University of Tasmania, who's part of the project management team, and also Alison Ward from the Department of Health and Human Services. These are the people who've basically done lots of work before I arrived in Tasmania in 2012, and it's their efforts that really make these kind of things possible. And then we'll talk just a little bit about the current priorities as we see them. So really, for us in Tasmania, I didn't go back to the first iteration of the food and nutrition policy, because we actually had one way back in 1994, which also had a 10-year cycle. And then in 2004 it was reviewed, and again it's just about to come up for a review. But I have to say that when I see statements like this, policy visions like this, it's something to get very excited about, because what we really want to exploit through these policies and the activities is, exploiting the great quality, having healthy, safe, affordable food, while considering things like its impact on the natural environment, and also looking at local economies. So you can see that that vision really brings together some of the discussions that have been going on in this governance stream for the last couple of days. But importantly, we also want to make sure that communities are empowered and that they can make really good food choices. This is a big theme for us. This food security policy, which is up for review now, has several sub-goals within it, and food security is a major focus area. But you can see again that we're talking about food security from a social, cultural and economic perspective. We're also acknowledging the challenges of geography and the physical barriers to access to food. So it's not just an issue around poverty, and we'll show you some evidence about that shortly. And that also we obviously need to consider the nutritional needs of Tasmanians that perhaps might have additional nutritional requirements. So that's a nice foundation. So we love it. And that's the kind of fantastic summer berries that we see just all the time in Tassie. Come and see us in summer. It's just abundant. It's wonderful. Oops. Oh. Okay. So from that food and nutrition policy, the next thing that happened, of course, was the development of the Food for All Tasmanians, a food security strategy, which David spoke about today. And the really important part of that strategy, and the unique thing that I think has made it so strong at a community level, was that it did use that social inclusion lens. And it also really importantly acknowledged that food and agriculture and access to food are really important social determinants of health. And because it's using a local food systems approach and this social inclusion approach, it has some real strengths when it comes to engaging with community and institutions. So the 4 priorities, David spoke a little bit about these, but this is what's in the strategy. This is what it says we're going to do in Tasmania. So we're going to increase food access and affordability. That's a big focus for the project I'm working on. We're about building community solutions, so we're not about imposing ideas into communities. It's about regional development and supporting social enterprises, because I think it's interesting to explore those things as well. So we do that in the Heart Foundation project, and also planning for local food systems. I'm not going to go into a great deal of detail on that today, but suffice to say that the Heart Foundation in Tasmania has been advocating for several years to have a state policy around healthy places and spaces. Some of you might know of the work we've done around active living, and also we have the fantastic food sensitive planning and urban design tool. So if you want to think about urban agriculture, I highly recommend that guide to you, which was developed by some very clever Victorians. So when we think about local food systems, and David did have this slide up today, and this is really important because this is the definition that we've adopted for the project as well. We have it when food is grown in a general locality in which it's consumed, transportation is minimised, processing actually occurs locally, and food can be purchased locally. And for us, of course, local means Tasmania. So there's a couple of things that follow that policy. The Food for All strategy, I'm not going to talk about them in any great detail because David did this morning, but I think the really significant thing that came out of it, so let's just look at the outcomes line, is around this community groundswell. I remember hearing an academic when I was working in Victoria about 8 years ago, and she was talking about what was going on in the US and how they really were able to talk about community level food security in their communities, and we were like, how come you're doing that and we're not? And it was because we really didn't have a good dialogue at a community level. There wasn't a good understanding of what the issues were. There wasn't a lot of organised activity. But one of the really big outcomes from the investments that have been made by the state government in Tasmania is that there is this really deep understanding. We've just had a funding round through the project that I manage, and the number of inquiries was quite, it was outstanding, and everybody really gets it. It's exciting. And of course, the other thing is it's really started to build this idea around local resilience, that we need to build this interdependency between the things that we're doing in local communities, see them as more connected. We saw this theme around social capital this morning. It's really, really important. And we think that that's actually why we're making the progress that we are in the project. The other thing that it did was it really made the community ripe, and that pun is intended. It made us ready for the next thing. So the next thing that came as a result of us having this great policy background was that the Department of Health had allocated some money through the Tasmania Medicare local for addressing health risk factors. Poor diet, nutrition and obesity were all coupled together for an investment in a project. So what happened in Tasmania Medicare Local, and can I say I was there and part of the team that developed the response to this, was that we decided to look at a project that was around creating supportive environments so that it actually would make healthy food choices easy choices. And to do that, what we did, of course, was look to what clever people are doing elsewhere, and of course I always do that. I love copying somebody else's great idea. I never start from scratch. And so we looked at the sort of frameworks that the Co-op's obesity collaboration at Deakin University uses. They have a thing called the Angelo framework, which helps you to focus your mind about understanding local determinants. We looked at Healthy Victoria Together. We've heard a little bit about that. Julia is going to speak in a moment about that as well. The World Health Organisation has some really nice frameworks for understanding issues using a place-based approach as well. And then, of course, there was another piece of research which has really heavily informed my work, which is about resilience to healthy eating. I'll speak to that in just a moment, and how even if you're in a low-income household, it can be achieved. And so the projects are about creating supportive environments, and it's also really importantly acknowledging the past efforts, and we're trying to close the gap, fill the spaces that have been perhaps emerged because of those past investments, and that's really made it clear for us what we need to focus on. Importantly, as is always the case, we're making our decisions based on local evidence and the policy and program context. So this is the Heart Foundation's project. It's a partnership between the University of Tasmania and the Heart Foundation. Our aim is to improve access and availability of fruit and vegetables, preferably locally grown, in communities across Tasmania. So we're doing food systems by stealth. When you put in brackets, preferably locally grown, all of a sudden you totally change the emphasis of the project. And that was really important. And anyone who's visited Tasmania knows there's an abundance of fantastic food there. So we really do feel like we can make healthy choices easy choices, but we are focused on fruit and veg because that's, of course, a measure of the quality of people's diet, and we also knew from population level surveys that we were doing extremely poorly on those measures, which unfortunately is quite universal in Australia. Okay. I'm not going to go through this line by line, you'll be glad to know. Suffice to say, there's been quite a lot of thinking, planning, talking, scheming that goes into the development and of these types of projects. I mentioned earlier that there'd been a piece of evidence that I'd read about, a study that had been actually generated by Deakin University, which was led by Claire Hume as part of her PhD. And I discovered this quite by accident several years ago on the internet. And for me, it was one of these sort of professional epiphany moments, because it actually showed me what sort of frameworks would be useful if we were thinking about how we could do action at a local level and what we need to incorporate or bring into the project to achieve some success. Because what her research showed, and she did it in low-income women, in Victoria, and they were in rural and regional and metro and all across the way, was that there were several factors that people needed to have running in their lives for them to actually be able to still eat well, even if they're on a low income. I think this is really important. We hear a lot about individual skills and knowledge to cook, shop, grow and prepare healthy food. Of course you need to have those fundamental skills, because you're not going to be able to achieve good healthy eating habits without it. But the other thing that came out of that research was that it was really important to have a culture of healthy eating in a variety of community settings. So places like schools, universities, all the cooking classes that are run in community and neighbourhoods houses, all of those places contribute enormously to this culture and normalising of healthy eating, and that's really important. And then the last bit, and this is really where the Heart Foundation project is very focused, is in this blue circle around creative, supportive environments for influencing local food access and supply in Tasmanian communities. Because what I've become increasingly concerned about is, and I know that there are many others that work with me who have also been concerned about this too, is that we often work in one bit or the other and we don't ever see it all together. So what we're purposefully trying to do is get busy in this blue bit, change the food that's available in local communities, but when we do that, we work in partnership with all of these other things that are going on, because then we actually develop a local system. If we don't link with them, you can teach as many people as you like about great food, but if there's not great food available in the shops, they can't act on what you've taught them. So we can't have people being set up to fail. That has to stop now. We have to have this system where we bring it all together. And of course we do it through partnerships, plannings, projects, policy. So the projects basically had 3 stages. The first stage, thank you, was around quite a significant effort around scoping. There was lots of conversations, there's been lots of meetings. Very importantly, we've done a healthy food access basket survey all across Tassie. I'll show you the results there. It does challenge some of the things that we've heard in the last day or so. And the University of Tasmania are also doing a very nice sub-project for us at the moment around mapping food growing. So we're finding out who's growing what, where, when. So we have an understanding about seasonal food, and also identifying growers who are interested in, thank you very much, working and seeing more of their product actually available in local retail outlets or other sort of alternative ways that food might be sold, farmers markets, co-ops, etc. Because as far as we're concerned, the more opportunities there are for people to buy that food, the better. We've also got a funding round. We make a decision about that on Thursday. I won't speak too much about that, but the emphasis on that is definitely to ensure that the solutions are about people being able to buy affordable fresh fruit and veg. And we're also very busy with this concept around community activation. There's local government elections in Tasmania this month. We really want to make sure that people have the same understanding as we do, so we've shared a lot of information about what community food access looks like across each local government area. We developed a profile for all 29. Oh, it was a crazy moment when I wrote that in my work plan. That was a serious endeavour, but it's been very successful as an engagement technique because it does have a lot of local information in it. We're also making sure that we use this sort of social policy language to engage with people around, who might be the people who would have an issue around food security. So, of course, we look at the census data around affordability and income. We look at things like, disability support payments, households that don't have a car, people that are that have fair or poor health, because there's very good evidence from Kate Burns and Luca Thornton from Deakin around, that disability and transport are also significant barriers to people accessing food. And then, of course, we're looking at the shops and what's available. So quickly, if I can get the slide to go. Okay, so the University of Tasmania has undertaken this survey. It's been done all across Tasmania. What a marvellous thing to be able to say we've got data across the state. Very nice benchmarks. It's not different from the Victorian survey, so 44 items. It's basically really a measure of the cost of good nutrition. And what we do is we look at the cost and availability of those items across a variety of store types, and then see what it takes as the percentage of different Centrelink payments for people to eat according to the Australian Guide to Healthy Eating. And this is, of course, when it starts to look bad. Okay, I won't go through all of the detail here either. There's a very nice big report which has just been released to the Heart Foundation as well. The analysis behind this is substantial. Suffice to say, and this won't surprise anybody, but if you can shop in a big supermarket, the cost of the basket is cheaper than if you shop in a small convenience shop. And the variation is significant. So if you've got a family of with two parents, two kids, the variation from the highest to the lowest over a year, it could cost you as much as $5,000 per year more if you're shopping in that location where the smaller shop is, versus the supermarket. So then everyone says, oh, well, everyone can just go to the supermarket. Well, unfortunately, it doesn't pan out like that. For us in Tasmania, there are 9 municipalities that don't have a major supermarket in them. So it's not as accessible as it might be in some other locations. The other thing that this identified right at the start was that, in fact, the areas where shops are located, only 5% of all of our shops were actually in the very low income areas. So if you say to people in a low income area you need to eat well, we need to change something about that environment. We also found that there was quite a range from the supermarkets. That makes sense, doesn't it? They have them all at lower convenience, at the general and convenience stores. There's much more variety, much less variety, pardon me. The other thing that's happening, as also as a result of the policy, is that the Tasmania Medicare Local has again made an investment in social determinants of health projects. So again, all of this is driven from the policy. That's the context in which it's delivered. And there are 8 projects across 8 different local government areas, and 5 of those are also about improving access to healthy food. So you can see that we've got a very big groundswell that's continuing, and they're looking at quite innovative things. There's one's actually opening a shop and a market garden based on the Nor Lane 2 and 5 model, for people who might not have seen that. We're looking at food cooperatives. There's going to be a skill building element, and also a very interesting project which is looking at determinant mapping. I should get an extra minute just for the pointer. So those things are really critical investments that, you know, are building on the current context in which the Heart Foundation project is being delivered. I think I'll finish on this slide. One of the things that came out of the scoping for us was there's this really large amount of what we're calling nature's grade produce. I stole that from somebody else. I can't patent it, that name, nature's grade, which doesn't make it to market. And when we first started talking in Tasmania, there were some people that kind of scoffed at us because we only had a couple of sources. But what subsequently came out, of course, was a report a fortnight ago from Horticulture Australia, which said that 25% of all veggies don't make it anywhere near a point of sale. I know you want me to finish. So we need to do something about that. We think that you know, food not making it to market and affordability, coupled with this affordability issue, we think actually those things are a great partnership. And so we're looking at lots of new models around connecting growers. We're again going to this economic resilience framework because this is how we need to talk about it, that it's good for local economies, it's good for local societies, creates jobs. And then the other thing we're doing, of course, is focusing on maintaining that very strong policy environment that we have, because none of this can happen if we don't have that sitting behind it. You just wouldn't see the money flow. So my I guess last message to you is that when you have an opportunity, whether as professionals or as individuals, to make some sort of submission to policy that's being developed, write a letter, take more time to do something detailed. We really need to maintain the policy, because when we have it, then it really happens. Thank you.
Thank you, Leah.